Hi there, Dr. J from Pure Chiropractic here again. Welcome to the latest episode of our video series. These videos cover the common conditions we see in the clinic, and we film them around the active, healthy lifestyle we want you to be able to enjoy. The topic for this episode is the sacroiliac joint, or SI joint. The SI joints are a pair of joints found in the back of the pelvis, very close to the belt line. Often you'll see a dimple in the skin on top of the joint. These joints carry the entire weight of the upper body, so there's a large amount of stress placed across them. Up until recently, it was thought that these joints didn't move and were not a cause of back pain. However, it has now been proven that these joints do in fact move, rotating with each step you take. They are, however, very prone to locking or misalignment. This is known as sacroiliac joint dysfunction. How does it happen? Well, it can happen through a trauma, but usually you'll see sacroiliac joint dysfunction following a long-term stress on the joint, such as poor sleeping or sitting positions. Oftentimes, I'll see people develop SI joint problems after an ankle or knee sprain, as there's increased stress placed on the SI joint when your normal walking pattern is altered. Similarly, pregnant women will often develop SI joint problems in the later stages of pregnancy. What are the symptoms? Without fail, there'll be pain over the SI joint. Your pain may radiate to the buttock, thigh, or possibly the groin. You may have read that SI problems do not cause sciatica. I've dealt with so many of these cases, I can assure you it can. If the misalignment is large enough, a muscle deep in the buttock, known as the piriformis, will be pulled tight across the sciatic nerve and give you true sciatica. The pain is generally worse with rolling over in bed, putting on your socks, or getting in and out of the car. Your lower back pain stiffness is generally worse in the morning or after you've been sitting for long periods of time. Very often the muscles around the area will be tight or spastic, known as guarding, and this is to prevent you from using the joint too much. As with most joints in the body, the SI joint is covered in a layer of cartilage. If left untreated, the SI joint dysfunction will lead to wearing away of the cartilage until bone is rubbing on bone. This is known as degenerative arthritis. Evaluation is critical to the successful treatment of SI joint dysfunction. Due to the complex anatomy and movement patterns of the pelvic joints, diagnosis and treatment of SI joint dysfunction is difficult. You need to find a doctor that is experienced in dealing with these problems. Diagnosis comes through listening to the patient's complaint, specialized movement tests, and possibly x-rays. You may have been told that x-rays are often not helpful in diagnosis. This is because most facilities take their x-rays with the patient laying down. X-rays taken in this manner are useless in the study of biomechanics. We take our x-rays with the patient standing so we can see what the spine and pelvis look like with weight bearing. Correction can take anywhere from 6 to 16 weeks. Several different methods may be used to restore normal pelvic biomechanics. For the long-term health of the joint and to prevent relapses, a stabilization exercise program is vital. So that's SI joint dysfunction in a short summary. I hope this makes things clear. If you're struggling with this or any other health issue, please give us a call. I'm Dr. J, helping you get back to life.